Every year, thousands of people are diagnosed with throat, tongue, and lip cancers. Tomorrow, there's going to be a free oral head and neck cancer screening, a very important test. And joining me now, head and neck reconstructive surgeon, Dr. Phil Pergosis. Appreciate you coming in to talk about this. This is your second year that you all have done this. You said last year you saw 40 people, and how many actually you were concerned about?
We saw probably about 10 suspicious lesions that were further investigated as a result of the screening.
So 25% of the people that you saw, I mean, that goes to show that this is a concern for folks. What are some of the symptoms that someone might have that might say, hey, this is a red flag, I need to be screened?
Well, usually in the mouth or there's ulceration, bleeding, swelling, pain, sometimes numbness, and further down in the neck, usually the presenting symptom is a swelling or a mass or a palpable lymph node, or a change in voice or difficulty swallowing.
And the problem is that when it gets advanced, you're already so far along that sometimes it's really difficult to treat. So what the screening is that, hey, that if you have some of the risk factors, and what are those?
The primary ones are a long history of smoking, and often with that is the associated alcohol intake. Other immune deficiencies where patients can't mount an immune response to tumor cells, and also this new group of patients that host this human papillomavirus.
Which is really a large population now when you look at the numbers of people who have HPV.
Right, particularly tumors in the tonsil and the base of the tongue. We're seeing increasing numbers of these types of HPV-positive cancers, and they're forming an increasingly bigger subgroup of patients that we treat.
Do you think Michael Douglas kind of helped raise awareness about this, where people are talking about it? Because it's very taboo. You know, no one wants to admit that they have certain things, you know, and then actually say, hey, I'm vulnerable to this.
Yeah, certainly. He did a lot to actually improve awareness of this type of cancer, particularly related to HPV, and also the introduction of the HPV vaccine that's now available to teenagers in schools.
Yeah, which a lot of kids are not taking advantage of, and the parents aren't either.
Right.
What is the screening? Because we don't want it to be intimidating. You said it's very simple.
Sure. It's a very laid-back process. It's essentially an examination of the mouth and the back of the throat, and examination of the neck. We palpate the neck for the lymph nodes and thyroid gland. And then toward the end, we spray, if in certain cases, not all, but we can spray and anesthetize the upper airway.
To numb that area.
Right, and pass a small endoscope or flexible camera to examine everywhere down to the back of the throat and the upper esophagus.
Okay, so all in all, it takes how long?
It takes about less than 10 minutes.
And if you see something concerning, then what's the next step?
The next step would be a formal clinic appointment where we have time to sit down and counsel the patient and explain to them what the next investigations entail. And then we do a workup and proceed to treatment.
All right, so don't be intimidated by this. Certainly something that we all need to be aware of, and this screening is a great opportunity to see if there is something going on and then get the help that you need. All right, so I'll tell you more about it. The oral head and neck screening, it is tomorrow from 9 a.m. until noon. It's at UF Health, located there in the Learning Resource Center atrium that is right next to the main hospital at 8th Street there. Again, kicking off at 9, going for the next 3 hours, ending at noon. Jen, over to you.